His promises to help families hard hit by addiction probably helped win him some votes in crucial Midwest states. And Trump himself attributed some of his victory to the crisis, telling the president of Mexico in January, and I'm quoting him here, "I won New Hampshire because New Hampshire is a drug-infested den." He won it in the primary, we should note, but lost it in the general. In March, the president created a commission to study the opioid crisis, and the group released draft recommendations a few months later, writing, quote, "The first and most urgent recommendation of this commission is direct and completely within your control. Declare a national emergency." Trump initially ignored that recommendation, even at his major briefing about the crisis at his golf course during vacation on August 8th. But 2 days after that, he abruptly reversed course.
The opioid crisis is an emergency, and I'm saying officially right now it is an emergency. It's a national emergency. We're going to spend a lot of time, a lot of effort, and a lot of money on the opioid crisis.
But you need emergency powers to address it.
We're going to draw it up, and we're going to make it a national emergency.
We're going to draw it up. Okay, that was 2 weeks ago. Since then, Donald Trump has signed no emergency declaration, has sent over no paperwork to Congress. Nothing has been drawn up. In fact, there's no official emergency, no emergency funds, no emergency programs. There's just nothing, because they have done nothing. Joining me now, Dr. Anna Lemke, who wrote about the opioid crisis in her must-read book, Drug Dealer MD, which is a phenomenal read, really important to understanding the roots of this crisis. Do you think it is a national emergency?
I absolutely think it's a national emergency, Chris, and I think we need to take steps immediately to address what is one of the modern plagues that we will be visited upon in this century. It's absolutely a crisis.
The numbers here are astounding, and this is part of what I think is pretty remarkable about the disconnect between this commission and essentially inaction. If folks just look at the per 100,000 deaths that have happened, and we've seen this unbelievable spike, are there things the U.S. government, this White House, could be doing today, tomorrow, to help?
So I think it's important to look at, since President Trump has been in office, he has introduced no formal legislation to combat the opioid epidemic. He recently declared it to be a national emergency, yet he's not taken any of the legal steps to enact that declaration. If he would take those legal steps, it would create access to funds to waive restrictions on Medicaid reimbursement, for example. That would make it possible to target the opioid epidemic. It would make it possible to dispense and distribute naloxone, which is an emergency opioid overdose reversal agent. It would make it possible for us to prescribe more methadone maintenance and buprenorphine, which are proven treatments for opioid addiction. So if he would just follow through on the declaration that he made a couple of weeks ago, that would make a difference, at least in the short term. I also think, though, it's important to note that most of President Trump's efforts have gone toward dismantling the Affordable Care Act. And the Affordable Care Act is the single piece of legislation that has gone furthest toward combating this opioid epidemic by expanding Medicaid to allow people who have opioid addiction to be treated within the House of Medicine. The Affordable Care Act has also made opioid addiction and its treatment an essential benefit. And this is so key to targeting this epidemic. Even the grants that we've had so far, although helpful, will not be a sustainable intervention for this epidemic. But if we give people health insurance to pay for addiction treatment, if we create an infrastructure in the House of Medicine to care for people with addiction, this is a sustainable intervention, which we will absolutely need, because this crisis is not going to be turned around in a year or two, or probably even 5 or 10.
There's a point of focus when the president speaks about the epidemic, which is the border and illegal drugs, particularly. And I wonder what you make of that, given the fact that your book chronicles the degree to which this is born of legal drugs, prescription drugs, and big pharma as one of the kind of root causes behind all of this.
So I believe that we all have an important role to play in combating the opioid epidemic. We have to get doctors to prescribe fewer opioids, but I also believe that law enforcement can play a role here. The important piece to understand is that although we cannot arrest our way out of this epidemic, we also can't prescribe our way out of this epidemic. And importantly, although law enforcement can play a role, the role that they need to play is getting people to treatment.
Right.
Or implementing modest, swift sanctions that encourage behavior change. What the war on drug did was it imposed extreme sanctions, putting people in jail for a decade for carrying an ounce of marijuana. That we know is not effective to change behavior around addictive behaviors, around substance use. But law enforcement can play a role. Shoring up our borders to limit the influx of illicit fentanyl is important. So we do need to acknowledge that those are ways we can intervene, but it's not going to be the whole solution. And I do think that the bigger and more important intervention is going to be expanding treatment to addiction and looking at, our impoverished communities and what other alternatives we can give them rather than becoming patients, getting on disability, and living these very sad lives of addiction.
All right, Dr. Anna Lembke, thanks so much for joining me. I appreciate it.
Thanks for having me.